Hi, welcome once again to Care Hoax. I'm Janet Cimorelli. I'm here with Dr. Herb Slavin, and this week we're talking about brain issues. So if you're dealing with any kind of memory loss, anxiety, depression, any issues with how your brain is functioning, this is the week to listen to and view all of our videos. So today what we're going to focus on would be testing. What tests can you do to see what your risks might be with regard to developing dementia or severe memory loss? And I have kind of an interesting recommendation, a recommendation about a scent test. There, for a number of years now,
Wait. A scent test, SCENT. So
Thank
you
you.
understand,
Right.
that's what she's talking
A smell
about.
test, all
Okay.
right?
Of course.
Okay, and so the scent test, there's information that's available about smelling peanut butter. So you take one nostril and inhale from an open jar of peanut butter, and you should be able to have a very specific ability to identify that it is peanut butter. Then you go to the other nostril and you smell the peanut butter. And so that's one of the ways to test with regard to brain ability to repair itself. And here's the theory behind this scent testing, that the olfactory nerve is the only cranial nerve that extends outside of the body. And when there seems to be a little less efficient function of the olfactory nerve, the researchers are supposing that potentially the brain is losing ability to repair itself. So that's the idea behind the scent testing. Dr. Slavin, what are some of the tests that you would be using with your patients and in your office?
Well, I'd like to also, in regard to that scent test, remember the zinc, I think it was called the zinc taste test?
Zinc tally test,
Zinc
yes.
tally, and that could be a deficiency of zinc could interfere with your body's ability to smell things.
Absolutely,
So
yes.
this, it doesn't automatically mean dementia, but having a zinc deficiency is not a good thing either.
For sure, your immune system is going to suffer, and then ultimately, if your olfactory nerve is being affected, it's talking about other things that are being affected because you're deficient in zinc.
And in the last recording, we talked about all the different things that might affect our brain function, and we didn't mention allergies. It's another big area.
Very interesting. Okay.
And allergies come either airborne or in the food you eat. So, I mean, it's a very broad area, very difficult to really find the culprit, but it's still worth testing for.
It's interesting because I talk all the time to the clients when I'm counseling about the knee bones connected to the thigh bones connected to the hip bone, this interconnectedness of how our bodies function. And so, you go back to thyroid. Again, certain deficiencies and certain assaults and lifestyle issues very much can suppress thyroid, and then down the road there are issues with regard to memory and mood.
Now, the routine testing that doctors do aren't enough to really determine why you feel the way you do. The testing they do is just to make sure you're not sick enough to be in a hospital, and then they give you a drug to treat the symptom you're complaining of. So the tests they routinely do are a complete blood count and a chemistry panel. They might add in a TSH, which is not the best way to evaluate thyroid function, and they might include a lipid panel. So from those testing, they can tell how sick you are or what drugs they can prescribe, but they're not really getting to how your body functions. And that's what, when we talk about the things we are emphasizing here, it's about functional medicine. It's about the things that go wrong in your body before you develop that so-called disease that they have a CPT code for and a diagnostic code. You really want to improve function. And so what you look at in that context, you look at inflammatory markers. That'll give you an idea if there's something seriously going on, even before a
Such
CBC
as?
or a chem panel is abnormal.
Okay, so the inflammatory markers you might prescribe?
Erythrocyte sedimentation rate, the ESR, the cardio-CRP, myeloperoxidase, the LDL oxidation, fibrinogen, and there's a couple more that,
Are escaping your mind right this moment?
yeah. Mhm.
Okay. What about, how accurate would a B12 test be?
Well, B12 is important. Usually, we'll do a homocysteine level, and that would be would sort of, if it's elevated, direct us to check the B12 and folate levels. So you can do a homocysteine. Doctors aren't doing that routinely either. Vitamin D plays a role here as well. Want to make sure the vitamin D levels are good. Now, so I mentioned the inflammatory markers. You want to, I'm just going through my mind, there are other inflammatory markers because there are large panels of these things that we check. And as far as function goes, you want to check your insulin level. That's going to play an impact on how your body functions. And since the brain is part of your body, it's going to play a role there. You do not want elevated insulin levels. That would be called, that would be hyperinsulinemia, insulin resistance, metabolic syndrome. They have terms, different terms for the same thing. You don't want high insulin levels because you can have normal blood sugar. See, that's what they check. The blood sugar could be normal, but the insulin level could be elevated, and that would be a problem.
So is the A1C also an important
Yes,
factor?
the hemoglobin A1C is your average blood sugar over a 3-month period. So many times you can have an elevated fasting blood sugar, but have a normal hemoglobin A1C.
How common is that?
That's common. That's
Really?
pretty common.
Okay.
Because the fasting blood sugar is really a reflection of what you ate the night before.
Right.
So you may have just splurged that night, so you're getting an elevated fasting blood sugar, but if your hemoglobin A1C is okay, so it's not that big a deal. And the same thing is, and vice versa. You can have a normal fasting blood sugar, but your hemoglobin A1C is elevated. So it says you're having too many carbohydrates. Pay attention to that. But probably most important is to see what your insulin levels are running.
What about infectious issues?
Yeah. So the reason I started testing infections in everybody, and what we're testing for is the presence of antibodies, which tell you you've been exposed to them. And most people have been exposed to many viruses and bacterial infections. And you have antibodies and you're not sick. But when these infections become active, you get sick. A perfect example of that, and one that's you can watch almost on a daily basis commercials on TV for, is the herpes zoster or shingles vaccine. They say you have it in your body, they lie dormant, and then one day it becomes active and you get the rash. But that's true of a lot of other viruses, and they don't have vaccines for them, so they don't talk about it. One of the most common viruses that they say 95% of the public has been exposed to and have antibodies, I think it's closer to 100%, is Epstein-Barr virus. And that's been associated with many different types of illness. In fact, you can almost Google the illness you're thinking about and say, associated with Epstein-Barr, and the answer will come back yes. But just to name a couple of things, breast cancer, prostate cancer, thyroid disease, all those things have been associated, all those health issues have been associated with Epstein-Barr virus.
Can you test for serotonin levels?
Yeah, we check for serotonin.
So certainly associated with anxiety and depression, low serotonin levels would very much fit into that picture. What about mold? I know that a lot of people are concerned, particularly in areas where there have been floods and hurricanes and so on. The potential for mold developing in your environment is very big.
I think mold and Lyme disease are two areas that are pretty much ignored as the etiology or the cause of the symptoms a patient complains about. And they're ignored because it's difficult to diagnose and difficult to treat. So the treatment for mold is first determining whether or not that's a possibility. And you can buy Petri dishes in stores like Home Depot that you place around the house, usually in a couple of rooms that you suspect that might have a problem. And you can tell if it's growing mold after a short time. And you have the ability for an added charge to send it in. It'll tell you exactly what type of mold is growing. So if you have mold growing in your house, obviously you've been exposed to it. And Lyme disease is even more difficult to diagnose. Even though there are blood tests for it, they're not that reliable. So you almost have to take a good history, and that would include whether or not you may have seen a rash at one time. People have Lyme disease, they never saw the rash. Whether you've been in an area that is more prone to Lyme disease, the Northeast is an area that's more prone, although I think all 50 states have probably reported Lyme disease as well as in Europe.
Yeah, they have kind of almost discounted having been bitten by a tick as the communication situation for being exposed to Lyme.
So how is it spread?
There are actually some researchers saying person-to-person spread. Very interesting and theoretical, I believe, at this time, but they have kind of come to the conclusion that not everybody they see with the symptoms of Lyme disease have been exposed to a tick bite. I just want to finish up our testing video with this scent test, a little bit more complicated than the peanut butter test. So, as I said, the loss of sense of smell may indicate that your brain's ability to repair itself might be declining. So, identify each one of the scents that I'm going to name, and the higher the number of scents you can identify, the lower your risk for developing memory loss and dementia. So the scents you want to be able to identify: peppermint, rose, fish, orange, and leather. And if you can identify all 5 of those scents, then your risk of possibly developing dementia or memory loss is low. So you've been listening to Healthcare Hoax videos, and I hope you subscribe to these videos, and I hope you share them, I hope you like them, and I hope you tune in again when we're talking about brain and the solutions you need to know about to minimize the possibility that you might ever be dealing with memory loss, depression, anxiety.